All right, so welcome. This is our first meeting of February, very exciting, and it is also our first meeting of the Cardea working group that is dedicated to sort of high-level reintroduction of our project. Today we have a very special guest with Jim St. Clair, but before we get into that, we need to do a little housekeeping. So this committee is governed by the Linux Foundation antitrust policies. The links to these can be found in our notes, which I've linked in the chat, but I will also send you the link for the antitrust policy. This generally means that we're not talking about financial things or business opportunities here. We're really sticking to high level and some larger technical details that affect everybody. Also governing this committee is the Cardea Code of Conduct, which is linked in our meeting notes. I will also link that in our chat here. The overall principles of our Code of Conduct are to be nice to everybody. I certainly would encourage your participation. If there are any issues with the Code of Conduct, there are several emails you can reach out to, or you can reach out to myself or Ken, who's our co-chair, and let us know that there's an issue. If there's an issue with one of us as chairs, you can reach out to the other or to Linux Foundation. Does anybody want to take a second to introduce themselves today?
I can. I'm Michael Zurich. I'm with CETA in the Digital Identity Program.
Excellent. Thank you, Michael.
Michael,
Anybody else?
I think you and I met at the Future Travel Experience Conference, didn't we?
Possibly. I don't see your face, and yeah, you look familiar.
Yeah. I think I know you guys had a big booth, and I remember talking about 4 or 5 folks from CETA when I was there. So
okay.
Excellent. Anybody else want to take a moment to introduce themselves? All right. Well, with that, we're going to take some time today to get an update from Jim St. Clair, who is leading the LFPH charge and will hopefully give us some insight as to where all of this is going over the next couple of months and year. So Jim, I'm going to pass the baton to you. You should be able to share your screen. Just let me know if that's an issue.
fantastic. It says I'm sharing now, and I'm on my Chromebook for today. So if there's any technical difficulties, just let me know.
Yep, we're good.
Great, fantastic. Thank you, and thank you to Trevor for the opportunity to present. Very much enjoy working with the Cardea project, and think there's some great things in the future. And Trevor asked if I would be willing to spend just a few minutes to kind of talk about the vision and direction for LFPH in the future, and more than happy to kind of go through some slides. I first put these together on my ruminations when I first joined back in October. So there may be a few areas that I can speak to for updates, but I only wanted to spend a few minutes kind of going through these and kind of thematically discussing, you know, where we were going next. So let's see, share your screen. There we go. I've got a little pop-up that's bothering me. There we go. So Linux Foundation Public Health as a name, of course, as everyone here appreciates, our origins and our raison d'etre heavily involve COVID response. But as part of taking this job and kind of bringing around and building a message, you know, I took a little look at public health over its history, especially going back to the 1890s. And there are many things that we're now talking about nowadays around health equity, what they call social drivers of health, social determinants of health, population health, that used to be part of public health to begin with. So, you know, unfortunately, sometimes it's clear that some of our conversations around public health during the COVID days have been limited, or arguments about, well, why is public health telling me whether or not I can go to an event? And why is public health involved with adjusting when rents are due, or unemployment? You know, those aren't public health things. But if you look back in the old days, and in fact they were, anything that was necessarily involved with improving health for a population were aspects of public health and health advocacy. And they led to things like labor activism, healthcare access, housing, etc. In our current state of public health, however, it's increasingly taken a marginal role because it's been separated out by State Department of Health Medicaid operations, the Affordable Care Act, private and commercial health involvement with healthcare delivery, the orientation towards consumer and commercial health experiences. And I just noted that as of November, when I put this together, the pandemic had prompted death threats on public health officials, had led to 27 terminations in state public health authorities, and about another dozen or so resignations across 13 states in the US. So it's really, I think, a good time to kind of reflect on what public health is, what the original message for public health was, and what we can do. Some of the challenges we have, there's just the understanding of the difference between the term health and public health and healthcare. This has come up just in talking about, should there be a rebranding for Lennox Foundation Public Health? What are some of the things that we want to address? And so much around policy and regulation and how health is done in the US is very payment centric. So changes to things like the delivery and availability of telehealth aren't limited by the technology solutions. They're limited by how you get reimbursed for it. And many people are surprised to know that even nowadays, they'll refuse to reimburse a telehealth visit with the same doc for the same services if it's in telehealth versus showing up at their office. But of course, we're still trying to avoid people showing up at offices and see each other. The cost models around healthcare, the lack of price and cost transparency, challenges with burnout and the great retirement. And then what are the new and emerging technologies, risks and benefits to consider around AI and ML and cybersecurity, IoT and the Internet of Medical Things, and how those face into the landscape going forward. One of the challenges I have when I talk about open source solutions in healthcare is the first thing they say is, well, the major EHR vendors, the electronic healthcare record vendors, they probably, want to try and stop some of this open source digital stuff because there's just a perception that the digital infrastructure for delivering in healthcare these days is, monopolized by Cerner and Allscripts and Epic as your three companies that are involved with electronic healthcare records. When there's really a huge gap of the population, both in the US as well as things going on internationally, that open source solutions are a perfect fit for. We're probably all familiar with the efforts of Amazon and Google Health and Apple and the like to make headway into healthcare delivery and the challenges they face with technological barriers. Digital innovations oftentimes belong to small players with proprietary solutions or proprietary algorithms. There's the corporatization and consolidation of healthcare organization versus what you still need in a rural access environment. And we're starting to see what we call health deserts, which are areas where the majority of the population has no access to primary care or other providers, or has to go exceptionally long distances in order to get to medical facilities. And then lastly, what I mentioned before about social determinants of health, which things we used to worry about in the 1890s under the umbrella of public health are now being labeled social determinants of health. And it doesn't matter whether or not somebody is coming in and getting their prescriptions or seeing the doctor if they have challenges with food security or housing or even fresh running water to their house, and how that factors into their overall healthcare, and the concerns about digital health equity and the disconnects in funding available for that sort of thing. So I don't really have to catch you up on this. This is a well-versed group in terms of LFPH and Cardea and the programs we've been involved in. But over the course of the last 2 years, we've built up membership and participation with public health authorities. I've worked with about 26 countries and 22 states and territories. This includes things like our Disease Investigative Technology Council, Public Health Advisory Council, et cetera. This is kind of a snapshot of where our members are, and very happy to have everybody here, to include, of course, Indicio for your support to LF and LF Public Health. Some of the channels we're working with in public health authorities, I just captured a few of these. Publications in peer-reviewed journals, ad hoc consulting, both the Advisory Council and the Disease Outbreak Technologies Working Group, which we now call the Disease Investigative Technology Collaborative. But these are looking at what are our next steps for technology evolution of what we've done so far around COVID response that could be considered for new open source solutions. got a couple good press quotes so far. And then most importantly, what to summarize for you all this morning is where do we go from here? Some things I've thought about and that I offer as thematic direction for the organization. As we've talked about so far, public health can be defined as anything that improves population health outcomes, in my opinion. Coming from old days in DoD decades ago, there was an attitude that if something was worth doing, it should be done in open source, because that fosters this sort of non-competitive, open, collaborative environment for developing transparent, explainable solutions for doing things that are of the common good or fit a common framework of participation. And that collaborative open source solutions can serve as a basis to address and redress policy and procedural challenges in healthcare. And it literally comes down to being able to say, hey, this works for the Tanzanian Ministry of Health for their open source electronic healthcare record solution. This is something that can work for Cobb County, Georgia. But Cobb County, Georgia doesn't want to hear that they're just like Tanzania, even if there may be parallels to their data structure, to their social determinants of health structure, to concerns about socioeconomics, to their availability of primary care providers. But yet there's things in that model and from an open source basis that they can be introduced to that potentially help with their health equity challenges, just like they're being done in other countries and with the UNDP. So some of the things that we have going forward right now, I'm trying to foster more internal collaboration between LFPH and other project areas like LFAI and data. Transparent ethical application of AI in healthcare is, I'm sure, a popular topic everyone is aware of. And LFAI and data has several initiatives around open and transparent tools for AI that I think are applicable for healthcare scenarios. Healthcare operations are moving more and more into the cloud computing. You may have heard things like the EHR company Cerner being acquired by Oracle, moving into Oracle Cloud, and CNCF can certainly contribute in those areas. Cybersecurity has become huge just since I put this on the slide, and the work in the Open Source Security Foundation around what they call software bill of materials and how that pertains to medical devices and increasing visibility into vulnerabilities and vulnerability management into medical devices. And Linux Foundation as a whole is right in the middle of that to include, briefing at the White House level. And then, of course, I'm thrilled by virtue of Indicio and Cardea being here around the topics of digital identity and Hyperledger. I came into Linux Foundation being very actively involved in decentralized identity in healthcare. That is still an area and a passion of mine and an area we'll be pursuing, and looking forward to ways to work on new specifications and things being done in the Trust Over IP Foundation in conjunction with health data and things like HL7 International to craft new patient identity structures using decentralized architectures from Hyperledger, which also fit into things like the EIDAS-2 framework in Europe or the Pan-Canadian Trust Framework, which really haven't begun to address, hey, I've got a new digital identity in the EU and I'm using my identity wallet. How can I connect that to my health data and be able to move my health data around the way that I see fit or that fits GDPR? So we're doing that sort of thing too. External collaboration, I want to continue to expand the Public Health Advisory Council. We're working on creating a Veterans Health Advisory Council, which will address veterans health issues and issues for technology and open source. All of those acronyms are associated with other major healthcare associations that have traditionally not been members or participants in Linux Foundation. That would be great to bring in as other stakeholders or representing other organizations to introduce them to open source. And then there's a number of, a very lengthy list of other open source projects already in existence, things such as World Vista, OpenEHR, Project Unify, others that are contributing open source solutions in many cases internationally or in the EU that would be a good fit for some of the things that we're doing in Linux Foundation Public Health to build and foster and curate open source solutions here too. And I think I got that through in about 15 minutes. I could not see the chat, so I'll stop sharing and more than happy to address any questions anyone might have.
That was great. As someone who speaks healthcare, I was able to keep up with all of the acronyms and things like that, but I just want to take a second and see, does anybody need guidance? Like Jim and I both know those acronyms. We speak them every day. We forget that we can say a whole sentence that means nothing to anybody else. So I just want to take a second before we even talk about content. Does anybody need clarification on any of the acronyms that were used or the lingo?
It's always funny to come from one group of geeks into another group of geeks and realize you have to change your geek speak for another group of geeks. And
Yes.
or questions about anything in general.
So
Yeah,
I mean, I can come up with a couple of questions, certainly.
Sure.
Which is, I think, one of the things that this community, of course, includes more beyond health, but that was one of the initial use cases that we were charged with. And as I've started to noodle on what other health spheres can be, can benefit from a digital identity and or blockchain solution, there's a lot there. I think one question that I have is, how do you see are there stepping stones that you guys have started to lay out in how we go from a COVID-centric conversation to these other things and really start to say, okay, well, for example, Cardea can do more. Let's start exploring those other spheres.
I think absolutely. And of course, just the COVID credential concept and the way that COVID credentials and certificates have been implemented, I think a lot of people suggest is a foundation, right or wrong, for how people manage health data in general. And so it's an opportunity to look at, some ways that it's being done correctly, some ways it's not being done correctly, and make recommendations to specifications and standards that we're all comfortable with, that embody selective disclosure and personal choice and consent. And if you look at Cardea from a machine readable governance standpoint, taking the next step of beyond some of what's been used for rules around, say, a COVID credential, and turning that into things like medication adherence, or I'm sharing my my social services or child welfare information as part of a clinical record because there's impact to healthcare concerns for an adolescent. Are there machine readable governance or rules that have to be considered as part of that model, both rules within the state, rules within the US, and then personal consent? I was talking with a state official yesterday, and we're like, hey, we might come up with a great model for how we're working consent for managing adolescent information for child welfare as part of their health record. But that's just us as one state. And then you go next door to New Jersey or to New York, and they're doing something different. And I said, that's where you probably need something of a machine readable governance model that allows you to have seamless interaction of rules based on different circumstances that's adjustable. And I think that's definitely a direction that we can go from this in a project standpoint.
Excellent. Excellent. And go ahead.
Sorry, I have a question. Sorry, Trevor, I jumped ahead of you there.
That's okay. Go ahead, Mike.
Yeah, and it's more on a curiosity, Jim, from what you're seeing. So we all know COVID hit the world fast, and that put us in a very reactive position. So everyone scrambled to do what was right based on the timeframes and the available technologies and solutions and general acceptance by the public. It came fast, and you're starting to see, especially with Omicron's spread, countries starting to look at relaxing endemic, living with it. Are you seeing or hearing from your discussions that drive for innovation on the credentialing and the what's been put under the Cardea, is that still going to keep enough wins in the sails for state level or federal level discussions that you're seeing, or is it more going to be, hey, let's just wait and see how it goes, as opposed to now it's hey, we have to do something, we have no choice?
Yeah, great question, Michael. And I think the challenge is just culturally, regardless of the country, the acceptance of vaccine passports, of COVID certificates and credentials. Speaking only in the US, I live someplace that doesn't give a damn about my COVID certificate at all. I've traveled to a few places where I understood the policy was to have vaccination status and be able to present vaccination status. They were happy with a picture on my phone. Even in the case of California, which has implemented its own smart health cards, vaccination certificate sort of thing, I went into restaurants and could just show my physical card. So it seems like there's just a lot of challenges in the consistency of application as to, is it something we're concerned about? How do we make it available? How are people using it? And it varies from case to case. And I think that'll remain a challenge for a while. I tend to use the TSA analogy. I flew right after 9/11, and there were essentially no changes to the way travel happened that they had just prior to 9/11, basically, you know, from September 10th versus September 12th. Fast forward 3 or 4 months, and it was complete confusion. Nobody knew what to do when they got to the airport. The rules aren't clear, different from place to place. Fast forward another year and a half after that, TSA was in place. People knew to take their shoes off. They went through scanners. So it took time to inculcate that sort of thinking and policy and culture, and then follow it up with supporting technologies. So I think there is a longer run to this, but it just hasn't really been settled out yet so that there is common agreement or recognition by everybody, if that helps answer the question a bit.
Yeah, I think, you know, it's going to be, I think, very interesting over the coming 6, 8, 12 months to see where things start to land, and what the appetite and appeal is for a lot of what we're looking at here, as far as, you know, innovating and exposing private information in a secure and trusted model.
Yeah,
Trevor?
well said.
Trevor, sorry.
Yes.
Jim,
is there any efforts being directed at clinical trial data management software in the sense that, you know, researchers increasingly want to be able to combine disparate databases while managing privacy issues? Is that something LFPH is potentially interested in?
It definitely is, and I didn't have it on the list, Trevor, and I probably should have included it for consideration. I do not have a strong life sciences background, but several of our members in Cisco and others do have strong life sciences programs that involve clinical trials or decentralized clinical trials, and making trial information available. And I've had some good conversations about that. So it is definitely an area of interest to consider as well. I haven't formulated kind of a strategy or participation plan, but certainly want to be happy to discuss.
I definitely see a potential need for academics who want a solution for managing research that doesn't require them negotiating with Accenture to build something.
Yeah, no, well said.
I have a question, which I apologize for those that are less steeped in healthcare policy in the US, which is, I'm curious what you think TEFCA does to this.
Oh, that's a wonderful
and how it
question.
interplays.
So TEFCA is the Exchange Framework Common Agreement. What Keela is referring to is the latest policy efforts from HHS to establish interoperability and health information exchange. They will lead to something called QHINs, Qualified Health Information Networks. And there is kind of a new playbook that's been released as to how it works together, how you participate in the common agreements, and how QHINs are supposed to operate. I think, Keela, as somebody that's known Marianne Yeager from years back at Sequoia Project, that there's areas of things such as identity and the identity information infrastructure, consent, and data exchange from a patient-centric standpoint that are a perfect fit for Hyperledger solutions and even some other open source solutions that could layer or framework on top of that. And I think that QHINs aren't necessarily economically incentivized to have a commercial solution or buy more software. So if there's ways that you know, a QHIN in Georgia can better communicate with a QHIN in Wisconsin, and an open source solution can do that, or a framework for machine readable consent and data exchange can do that, then it's a great fit as an open source project for us.
Yeah, having heard her speak at a conference not long ago, she wasn't really selling the QHIN model. It was sort of like, you don't want to do this, but we're working on the requirements so you can read them when we're done. I mean, that's basically how she approached that. It was very interesting. So that would be an interesting concern. I think the other question that I have kind of goes to the, we're all purists in our data security mindset, and we live in that world every day, regardless of which industry you're focused on in this committee. But the reality is that, like just yesterday, I saw somebody post their entire COVID vaccine status in detail with the lot numbers and the dates and like all their PHI on Facebook. Again, still here we are, 2022. So part of me wonders what, if anything, LFPH is considering in terms of a community education plan around why data security matters. Like, why should Joe Schmo care about this and not just giving their stuff to Amazon and Google and because it's convenient to them? Do you guys see any gap there or need to cover that? Is that maybe outside the purview of LFPH?
Yeah, I'm comfortable in saying it's outside our scope.
Yeah,
I participate in other groups that do more of the advocacy and the communication and the awareness and that sort of thing, but it won't be an initiative or a thrust that we have here.
Okay.
A good point.
Yeah, we can build all the security we want, and then people post it on Facebook. Sort of like
Idiot goes around it. Yeah.
Anybody else have a question or comment? Okay, well, I think there was a lot here, Jim, so we may need to noodle on it and want you to come back again to dissect some of this.
Absolutely, anytime.
Wonderful. Okay, thanks so much. All right, so moving on to other agenda items. Today, as we discussed, is the first official meeting that we're having after we've rejiggered our organization of these work groups to sort of do an introductory call. Now, truth be told, I don't see that many new people here today, so we can just do a quick, I think, high-level overview of where things are, how to access everything, and see if there's any questions that anybody has that we can answer. So I'm going to go ahead and share my screen now and walk through it. So I did chat the meeting notes. You can see we have each date called out here. I've started to highlight, sorry, if I go to the top of today's notes, the content of the meeting is also being called out. And so you can go back and search for all sorts of things through the very beginning of time of these meetings. And this is a great resource to look for topics discussed and things that need to be followed up on. So moving to our agenda for the rest of this. So how to engage? Obviously, you're here at this work group. We are working toward our next Interopathon. The Interopathons being a really great opportunity to get your toes wet or jump in and then participate technically with this group and see sort of how you've picked up the technology stack and are able to play with others. Most notably, we have our groups IO and Slack that's sort of for other participation and collaboration. In terms of where to go for information, so our new website, which we've reviewed, has a bunch of really helpful links at the top. We have our meeting notes linked here, our playbook, which we can go into in just a minute. All of the meeting recordings, as up to date as we can keep it, are also available. So if you can't attend, don't feel bad. They're there. Our GitHub, the code of conduct is linked here as well, and other project related links. So we've tried to redesign the navigation so that everybody can find what they're looking for and make it a little bit easier to engage. So I'd like to take a second and just walk us through the GitHub if you haven't been here in a while. So there is a repo specifically for the schemas that we've designed for this community. So you can go and see that here. I actually have a comment. I think these need a round of updates. We've just changed the expected structure, not the content of them. Other than that, there are, oops, sorry, one more. there are the enterprise agents, of which there are two. There's the health enterprise and the government enterprise agent. Those in our, and I was trying to get an image of our trust triangle, but those are sort of the behind the scenes on the issuance or verification of the rules. Similarly, there is the mobile agent, which is in this case, the wallet, and the mobile verifier, which is the one that you're sort of initiating the relationship to check your credential. Those are the general components. I'm not sure. I don't know. We were missing some of our technical folks today, so I'm wearing my best technical hat on the details of this repo. I'm not sure if there's any questions on this or how to navigate it. Otherwise, within each repo, I don't want to go to the UI one, I apologize. Within each repo, there should be READMEs which have some instruction, and one of our follow-ups is to work on further documentation about how to navigate these if you are new and less comfortable with picking up some open source software and running with it. Any questions on Git? Excellent. All right, and the other thing that I wanted to touch on, and we had Jim today give us a detailed dive into the health sphere, and sort of he also hinted at some specific use cases where this Cardea model could be applicable even beyond the COVID scenario, right? That includes, he mentioned consent, which is a huge challenge in the healthcare community, but also other areas around, for example, he mentioned medication, conflicts, excuse my puppy, and then but there's others as well. There's verification of certain things, like, did you get this thing done? What were the results? If there's an order of operations required, in some cases provider credentialing, are you board certified as a provider? There's all sorts of industries in the health sector that applies to. I'm curious if anybody wants to throw out others. I listed 3 here. There's sort of the travel industry, which is crosswalking to health at the moment. I know we have some engagement in the sports universe and entertainment, and then we've just discussed health in depth.
Well, hi there, this is Christy, and we're looking at a sports application, but it really is so much more than that, because it really does come down to these core issues that you've touched on so far about transmitting information, right? That's personal health information that you want to keep confidential, and it's heavily reliant on consent. And then also verifiable data, verifiable issuers, who can be trusted, who cannot. And so even though it's in the sports and entertainment and then other industries, I think going forward, there is a heavy reliance on being able to verify data, its accuracy, verify the party that collected the data, that's disseminating the data, and then of course having these credentials and educating people how to use them. And I'm just finding as more people are coming into this space within the sports industry, I think those are the things that they're missing, the most important aspects of how do you maintain private health information and manage consents, verify accuracy of data, and verify who can be trusted in the exchange of the data.
Absolutely. And I think those are really the pillars, right? That this whole ecosystem is trying to build on and also to address and resolve. Right.
It is, and that's where the value is. I guess that's my point, a long-winded way of saying that's the value that I think some people who are kind of entering the sports industry, they see the dollars that are available to bring some order to the process of sharing data. But I don't think that is robust enough to accomplish what you are trying to do here, which is really what's necessary.
Great. Anyone else have comments on industry specific nuances or details about use cases there. I think that, you know, really what it comes down to is those components and then applying them to all sorts of industries. If you look across the board, you know, having the trust, the security and sort of privacy framework there, being able to manage the consent around sharing that, whatever information it may be, those really are pillars that are repeated and can be applied wherever, whether it's health or travel or as we've just discussed, sports. Okay. So I think then that are there other, so I think the other thing that I would like to discuss quickly is navigating this specific, so this is our first week of the month, of the calendar month, and we're dedicating this to sort of reducing barriers to entry. So for those of you that have been participating, which are most of you on this call today, I'm wondering sort of what you'd like to see this meeting cover. I had one idea, which is that we can kind of perhaps split up and deep dive, but at a high level into different components of this infrastructure and ecosystem. But I'd like to hear from you guys who are continuing to engage and have been engaged. What would be helpful? Is there anything we can do to step back and close knowledge gaps in looking forward at future meetings?
Yeah, I'll jump in here. Hey, everybody, it's Helen. I was just, thinking more about how to grow this community and grow awareness of this community. And I think based on the hundreds of people who are taking the Hyperledger Aries and Indy workshops in the last couple of weeks, there's definitely an interest in this technology. And so having more education opportunities for education in this project might be helpful, kind of describing where the repos come from and what you can do with them. And if maybe you're only working on one part of the technology. For instance, what we saw at the Interopathon, where folks were like, well, I just want to test this part, or I just want to test this component. I don't know. I think there's some more education that would be, workshops and things that maybe in DCO could take on, and bringing people to like a Cardea supported or sponsored workshop series. I don't know. It might be helpful.
Yeah, and I think I was going to a similar place, Helen, which is perhaps this first week of the calendar month could be something like that, in which case, I don't know if we've gotten any feedback on what some of those workshop education sessions should be, but that I think really is the purpose of this this first week goal, right?
Mm-hmm. Yeah, I mean, I think that if we were able to say, oh, come on, on this day, sign up for this, 1 hour workshop, how to do, whatever, fill in the blank, and we could work with the tech team to see kind of what elements are kind of the most challenging to overcome. It might be a good way, not to get people to necessarily just start showing up to meetings and contributing, but at least kind of wrapping their minds around what Cardea does and how close they are or far they are from being able to kind of interoperate with other folks in the community who are picking up the technology as well.
Great. I think just hearing you describe that, it's one thing for us to review the repos and the components at a high level, but I think it's sort of like, okay, if you're going to then download this, right, and work with it, where do you start? Like, what are the configuration files that you're going to want to go into and say, is this how I want it? If you want to tune it this way or that way, and sort of understanding where those configurations live and where somebody who's picking it up and wanting to customize it could start. I think that's a really good point, because that is quite intimidating if you're not, if you don't want to spend hours educating yourself on what's the code's doing and figuring it out. You sort of want the cheat sheet. Let's get something going. That's a great point.
Yeah, and I think at the same time, that's sort of for the technical folks, right? Of how the technical folks are going to get involved in this. But if we're looking also at sort of those business decision makers, saying, getting them sort of on board with allocating, budget and time and headcount towards, working with this, working with the project. I would say also creating some documentation or materials that can be easily picked up to justify this type of investment into open source. So having some Cardea based documentation where it's like the why, kind of like when you want to go to when you used to be able to fly to an event or a conference, it says like, making the case to, justify the expense to your boss or whatever. But it's the same kind of thing where we could, justify the expense of going down this road and, really drawing out the value prop, drawing out if you do this, this will happen. And making it really easy to consume, a consumable or a leave behind for that sort of audience.
Yeah, great. I think, what's interesting to me, Helen, is that we've got this great attendance happening, which is conflicting here with Hyperledger, which is wonderful. And how do we bring them over? But then my second question is, even that attendee list is still going to be on the technical side. And so we have to figure out, how do we break through to some of that other, non-technical leadership as well?
Mm-hmm.
Jim, I have a question. If I apologize if you're multitasking, but I have a question, which is, you mentioned hymns.
Mm-hmm.
Hymns is coming up. I'm personally not going this year. If you've ever been to hymns, it's very overwhelming. But it sort of raises the question, like, those are places, hymns, AHIMA, those sort of well-attended industry specific trade events are where the non-technical people are going.
Right.
And what are we doing to encourage and entice, the business decision makers at that level?
Great question. I'm going to Health Vive in Miami the week before HIMSS, which is becoming a new HIMSS rival. Then I'm going to HIMSS in the middle of March in Orlando. I don't have a big agenda in terms of who I'm seeing, other than just I'm going to use it the same way I've used it when I worked for other companies or organizations, to create awareness. We are not exhibiting in either one. Exhibiting or sponsoring an event is certainly something to consider for the future. I think that there is a great overlap in things like what we've talked about for travel and information and that sort of thing here that relates to healthcare, that could be a good message or a good presentation there. And can certainly, and as you said, it's certainly the right place to get decision makers in healthcare environments engaged with conversations.
Great, thanks. I think the other thing to just point about health is notoriously slow to adopt change. So I think the runway for driving change at scale in health is going to take a little while. That would be my sort of opinion, but that there are so many applicable use cases. It's just getting over those hurdles around privacy and security, and why is this the right way to do it, that need to be really polished.
Well, and as I said in my presentations too, the first thing I get is, does this integrate with Epic or does it integrate with Cerner? The interest is, where does the EHR fit in the conversation? So I think healthcare is starting to have conversations that are more and more outside what the EHR dictates that they do in their process flow. But to your point, it's still going to take a while.
Yes, and it's interesting because those are private companies, and I think that they how they perceive this is also going to be very interesting. I think that they could either use it as an advantage or see it as a sort of a threat to their fiefdoms. So that's also going to be very interesting, because some of that ownership of the market and things like that really are where they've positioned themselves over years of development, and having those data warehouses and aggregating things is their core. So seeing how this upends some of that, I think is going to be really interesting.
This is Christy, and I agree with that. But I also want to mention that coming from the legal side and having worked on corporate legal teams around technologies and dealing with open source, I kind of grew up with the philosophy of, you want to preserve the exclusivity. So open source was almost a dirty word. And I have been convinced and converted to this. So it can be done. I want to say it can be done, and it just goes around educating people. And I think it will just take, it's like everything, just like you said with the health industry, it takes time. It's like the law. The law doesn't automatically change, but adoption and adaption increases over time. And there are really good arguments to be made for this model that I think people will grasp.
Yeah. Interestingly, one of the conversations that we're having offline in the health industry is, and this is rather common in the health universe, is okay, open source, great. What if we're hacked? What if the ransomware attack comes? And then who's liable? And I do think, Christy, to your point, there's really this very interesting legal proposition that needs to be clarified and worked through and navigated. And I see, Jim, maybe you have some comments there, because this is really quite dicey. It's change, and change is hard.
It is, you're right. And so on the hacks, I threw a comment in the chat. I believe that I, as the executive director, am solely responsible for presenting back to you where LF is going with their security requirements. So there's an enormous open source security initiative within LF. And the expectation now is that all LF projects will have the security seal of approval and go through the alpha omega security review process. So that's probably a good conversation for another Cardea technical meeting. But to your point, it's kind of interesting because people want to point to open source around issues of being hacked, when in fact, there's all kinds of things that they could be doing in terms of their security policies and procedures above and beyond the open source that's involved, whether they're using Epic or email or an open source software solution. There's security policies they should have. And healthcare is notoriously bad about their application of that. Plus, it's also just difficult. What you expect Mayo or Ascension to invest in information security is totally different than East Middle Tennessee Community Clinic can invest in their information security. So, a rising tide kind of raises all boats in terms of promotion and improvement.
Right. Well, and then there's Dr. Jones, who has a practice in his first floor and he lives upstairs, right? Like, what kind of security does he have and policies? And that's certainly
that's a shared EHR system with a major medical system that he has practicing authority at. So his records and system connect to another system as a vulnerability point.
And I love this conversation, and I want to just add too that in addition to those policies and the processes and procedures that people will implement, is how they are negotiating the contracts with the various parties to shift risk, right? With whether it's their indemnifications or their warranties. So I would expect, I've already seen those starting to evolve as well, to embrace a different model. And I think they're going to have to.
Yeah.
Otherwise, the litigation costs will be too high, and that will motivate people to change.
And it brings us back, I think, to the open source discussion, because open source platforms are developed transparently and collaboratively, and multiple stakeholders are involved. And when you have a proprietary solution, it comes down to just the strength of your SLAs, I think. And, there's lots of organizations that aren't necessarily, I'll say, technically equipped to properly negotiate an SLA. And Christy, you've probably seen this, firsthand, and are taken for suckers.
Yeah, that's a great point.
In terms of reliability. So.
Exactly. Yeah, that's a great point.
Very interesting. Okay, well, then we have a lot to discuss. I'm curious if others in the group are equally as interested in the security concepts and underpinnings that need to be discussed.
I think this is really important that we know how to discuss them, because we're all, we have a market to educate.
Right. And I think also perhaps educating ourselves in the different business pillars around what is applicable, not in detail, but at a high level, right? And so for healthcare, there's HIPAA and there's high trust and there's high tech and there's existing regulation, and that's kind of where the meat and potatoes are. And there's the golden standard and what that contains. But I don't know what those are in other industries. Maybe in some cases they don't exist, but of course financial has its own pillars of what it means to be really good at your security. And I think as we live in a world where, ransomware attacks are happening much more frequently, right? There was just another the poll kit vulnerability last week. So there's a lot happening in this world. And I think that if we can meet that early, then we may have more people listening.
Yeah. Jim, what's the bridging, what do you see as the bridging mechanism between LFPH security groups and expertise and health credentials expertise? I mean, is that something that CCI might envision as a future activity, or should this group actually take it on?
Trevor, I'm not sure I have a perfect answer to the question.
I only formulated the question like a minute ago, so I sure don't expect you to have it down off the top of your head.
Well, that's okay. What I could offer to you, a direction that I am going, is trying to involve at a high level more and more work around SSI and decentralized identity with zero trust architecture. So I have argued that zero trust architecture and SSI are two sides of the same coin.
Yeah.
And the ability of the individual to manage their identity potentially in an adversarial environment is just like somebody trying to maintain network identity and access management in a potentially adversarial environment. So, blockchain's all about, I don't know you, you don't know me, and we don't want to know each other, but we can set up a trust framework to be able to do transactions together. And to me, that embodies verifiable credentials and ZTA at the same time.
Well, the other so actually then the question might be formulated: is it worth having a decentralized identity zero trust working group? Because we see, verifiable credentials as being the easy way to manage the continuous verification needed for zero trust approaches.
I agree to 100%. The answer is yes. And I'll confess that I actually have a conversation with one of our board members at Cisco about the topic on Monday. So
okay.
If you're interested, I'd be more than happy to throw the momentum behind it.
Sure. Well, we have one of our node operators is one of the key figure, Dr. Chase Cunningham. Dr. Zero Trust is one of our node operators. So and he was instrumental in driving the Defense Department's 100% adoption of zero trust. So he's a busy guy, but we can also drag him in if we can put him to good use.
Yeah, let's plan to immediately follow up on that, because I'm actually involved I'm actually involved in some working groups at the federal level and trying to figure out ways to do pilots involving the DoD's implementation guidance.
Oh, good, excellent,
interesting.
Groovy.
Okay.
Yeah, sure.
Great. Interestingly, just speaking about government things, right? There's the whole IRS thing, which is a centralized, I believe, model. So it'd be interesting to learn a little bit more as we start to have those conversations.
I think we all there was a giant sort of sigh of dismay with the news from IRS and ID.me because it's a disaster.
Yes, and the article that I was reading says that when you agree to do it, you're also, and I mentioned this at our last meeting, I think you're also agreeing to waive your right to participate in class action lawsuits if there were an event of a hacking event. So you're sort of that, it sort of goes back to the educating people about the awareness of where their data is living. And those of us who are aware and willing to say, wait a minute, and then so many people just doing it because of its convenience.
Yeah, well, the Boston Globe has called on the Biden administration to immediately rescind to this.
Yeah, and Jim, I saw you posted something in the chat. Excellent. I will put that in our meeting notes so everybody can take a look at it, which is from Bloomberg. Okay. All right, so I think that covers our agenda for today. Next week, we have a technical focus. Thank you for these links. I will put, Jim's putting some very interesting things in our chat. I will link those into the meeting notes so that you can all follow up on them.
The second one is an article in CNBC about the fact that as Apple rolls out their mobile driver's license platforms, they're forcing states to sign up to Apple SLAs and essentially say, Apple can change the code when they want. You have to do what Apple says, and basically inserting themselves in the processes around how a state operates a identity for a citizen.
Wow, very interesting. Very interesting. Okay, next week, as just a quick reminder, is a technical check-in. I'm hoping that we will be able to lock down the details of our upcoming Interopathon. And so we look forward to having you participate at that meeting.
Thank you.
Thank you.
Thank you.
Thanks,
Thank you very
guys.
much. Have a good one.
You too. Have a great day.